Okay, Assalamualaikum warahmatullahi wabarakatuh and very good morning. My name is Hakim Ibrahim, metric number 2190216, and in this video I will talk about the impact of euthanizing COVID-19 patients. Let's check it out. Okay, euthanasia, also called mercy killing, act to practice of painlessly putting the death person suffering from painful and incurable disease for incapacitating physical disorder or allowing them to die by withholding treatment or withdrawing artificial life support measures. Because there is no specific provisions for it in most legal system, it is usually regarded as either suicide or murder. Physicians may, however, lawfully decide not to prolong life in cases of extreme suffering, and they may administer drugs to relieve pain, even if this shortens the patient's life. In the late 20th century, several European countries had special provision in their criminal codes for lenient sentencing and the consideration of extenuating circumstances in prosecutions for euthanasia. Okay, COVID-19 is a new outbreak of pneumonia caused by novel coronavirus began in Wuhan. It subsequently spread to many countries around the world. The World Health Organization (WHO) announced that COVID-19 is a public health emergency of international concern on January 30, 2020. On February 11, 2020, WHO announced that the novel COVID disease was to be named coronavirus disease 2019 or COVID-19, and that the virus that caused the disease was to be named acute respiratory syndrome coronavirus 2 or SARS-CoV-2. As of 11 March 2020, the COVID-19 epidemic continues to spread. There are more than 80,000 confirmed cases in 34 provinces or regions of China, and cases have been confirmed in 106 countries. 106 countries, including South Korea, Iran, Japan, Italy, United States, and even in our countries, Malaysia. Okay, now I will go through the SWOT analysis of the impact of euthanizing COVID-19 patient. Okay, first we go to strength. Okay, the strength is upskilling in new technologies and resources. Okay, now this is the opportunity to develop technology skill. Okay, the chance to upskill and incorporate alternative software and novel resources into our teaching. This suddenly in upskilling and innovation by a large proportion of academics has the potential to transform medical education by incorporating online learning to all aspects of the curriculum. One academic stated that this was an opportunity to improve staff awareness of online teaching methods and their confidence in using them. This is a unique opportunity to assess the educational benefits of this software encouraged by free license offered by many companies during this time. Okay. Furthermore, it has triggered the development of new skill assessment modalities, as all universities have adopted an online approach to written examinations. New skills in utilizing the full capabilities of virtual learning environments are being explored. Virtual learning environments allow academics to easily build question banks and design assessments that can be marked automatically or manually. Virtual learning environments also facilitate randomized presentation of questions, time constraint, and prohibit backtracking in order to prevent collaborative answering. Okay, now I will talk about the weakness. The weakness is lack of practical sessions and cadaveric exposure. Cadavers are utilized as the pillar pedagogical tool in many medical schools across the globe. Not physically attending practical sessions will limit haptic understanding and reduce discussions concerning variation and pathology. The benefits of cadaveric-based teaching have been eluded in a number of studies. Cadaveric-based teaching has been shown to lead to a deep understanding of the three-dimensional relationship of the human body and allows students to appreciate anatomical variations and pathologies. Issues with assessment. Okay, in my investigation, I can see that 29% of the institutions surveyed did not have pre-existing summative assessments based on practical content. Of those that did, about 30% cancelled the summative element and about 20% switched to online assessment to maintain normal student progression. However, online assessment pose their own unique challenge. One key principle that need to be considered is the preservation of constructive alignment of the assessment task to the intended learning outcomes and teaching or learning activities. Next, the opportunities. Okay, the opportunities is academic collaboration and working remotely. The COVID-19 pandemic presented opportunities for online collaboration between academic peers, both within and between institutions, to gain insight and inspiration from others that are facing similar challenges. External collaborations can act as a source of support and particularly important in institutions with a small team of anatomists. Nurturing these collaborations and developing an online community of practice in the future is a huge opportunity for the anatomical community. This is especially important for next academic year, as the impact of COVID-19 on the body donor program and anatomical education is yet to be fully. Okay. Last but not least, the trick. Okay. Unknown source of the pneumonia outbreak at the start of the COVID-19 epidemic. Okay, at present, the source of the original pneumonia outbreak at the start of the COVID-19 epidemic and the transmission mechanism of the virus are unknown, and there is no specific treatment available. At the time of completion of this manuscript in early March 2020, the COVID-19 epidemic is still rapidly spreading around the world. Okay, next doctrine is impact of COVID-19 on public daily life, work and psychology. Okay, during the national extended spring holiday period, most enterprises and institutions suspended production and operations. The opening of various schools have been delayed. Some railway and flights have been suspended, and many people have been isolated at home. Okay, third about the threat is impact of COVID-19 on the national economy. From the current policy adjustment of various national departments and changes in public life and work plan, the main domestic industries that affect the country include service industry, including accommodation, tourism, and catering. In infrastructure is including construction, machinery, transportation, investment, and power heating, and transportation, including rail, land, and road. Due to international restriction, the cancellation of international flights may cause some fluctuations in import and export trade. Okay, that's all from me. Thank you.